Yo, what up? It's a tip of the week, and this is the fourth part of the drugs that you need to have in your basic drug kit. All right, so let me just get this out the way. Make sure your drugs aren't expired. Make sure you know where your drugs are. And most importantly, make sure you know how to use these drugs. All right, let's get into it. Number one, Dextrose. Dextrose 50/50 is a drug that you would use. Wait, drug? Yes, people. For the love of God, understand that sugar is a drug. So many people think that sugar is not a drug, just lay people, because like, oh, I just could take as much candy bars and all that stuff I want. No, sugar is a drug. So if you're using it excessively, you're a drug addict. Drug addict. All right, let me get off my soapbox. All right, let me get back to it. Dextrose 50/50 is a drug that you would give for patients who are hypoglycemic or low on their sugar, their blood sugar. So the route in which you want to give this is you could plug it up to an IV and open the line and push 25 to 50 mLs of 50/50 dextrose into the IV, and generally that's going to be sufficient for patients that are hypoglycemic. All right. Number two, aspirin, baby aspirin, or aspirin 325. That is a drug that you would use for patients who have chest pains or some type of myocardial infarction. You could do STEMIs or NSTEMIs. That's basically where there's an elevation in the T wave or a depression in T wave. So it just depends on if you can read the EKG and if the patient has a chest hardness and different things like that. I'm not going to go over that in this video, but I just wanted to give you an idea of the medication that you could use so that when you see somebody that's having some type of chest pain, you could use aspirin. I'll give you a little bonus. Anytime a patient's having some chest pain or something along the lines, just remember the acronym MONA: morphine, oxygen, nitroglycerin, and aspirin. And aspirin is a drug that we're using today. Aspirin, that route that you want to give it is orally, where the patient will chew on it, especially if they're having some type of chest pain. Have them chew about 4 tablets, 81 milligrams, or just have them chew the 325 tablet. It's better for them to chew it. It absorbs faster than just having them take it and swallow it. It may be nasty, but would you rather have a nasty taste in your mouth or die? Yeah, you pick and choose. I want to just put it out there bluntly. So just have the patient chew it up, swallow some water, and you're ready to rock and roll. Last but not least is a glucose paste. Once again, glucose is a drug, so just keep that in mind. So if a patient is having, once again, they see that their blood sugar is going low and you don't know how to get an IV, go ahead and get some glucose paste. You could use frosting. One of my favorites is going to be Pixie Sticks, because Pixie Sticks, they really don't have an expiration date, and they taste nice. And if a patient is about to go down, you could just throw this in their buccal vestibule on their cheek, or just put it on their tongue. Put a couple drips of water if they're really out, and watch them generally perk back up. Really isn't a overdose that you could do. At least I'm not going to discuss it on this video. So make sure that you are paying attention to that. So there you have it. This rounds out the basic drugs you need to have for your drug kit. Once again, I'm Dr. Jared Williams, and my focus is for you to smile after surgery. Make it a great one.